Alright, so today we are going in to take care of our patient JT. I was looking at her chart already and it said that she has aphasia, and when she walks, she kind of shuffles her feet and has right side weakness. So her daughter just kind of wants to know if she needs to be sent to a nursing home or if they can keep her here in the assisted living for the time being.
Okay, good. Well, there's a chart that we can use for people that have aphasia, so maybe I'll go and find that and we can bring that with us.
Oh, yes, that would be great, Hallie. I also think that we should turn the lights on to a nice brightness because in therapeutic communication, that is a key thing to have a nice communication with your patient.
There are many therapeutic techniques to communicate successfully with a person with aphasia. Minimize or eliminate background noise. Keep your own voice at a normal level. Keep communication simple but adult. Give them time to speak. Communicate with drawings, gestures, writing, and facial expressions. And confirm that you are communicating successfully with yes and no questions.
Hi, Miss JT. My name is Hallie.
I'm Carla.
We're here to do your assessment today. We have brought in a visual aid to kind of help you with things. So when we do your assessment, if you're having trouble verbalizing, you can use this. Okay.
Are you her daughter?
Yes.
Okay, perfect. I saw on her chart that you were her main caregiver.
Yes.
Perfect. So we brought this to help out with our communication, but obviously if you feel like you know more about her needs and her wants, it would be helpful for you to let us know as well.
Okay.
How are you doing today, Miss JT?
It's important to assess a patient based off of Maslow's hierarchy of needs, as it addresses each aspect of patient care, which includes physiological and psychological needs. Using Maslow's hierarchy of needs, first assess the patient's lines, drays, and airways. JT was found to be breathing on her own, has adequate hydration, and food intake.
Do you know why I'm here?
For assistance.
Carla and Hallie have no biases towards JT, as shown by their professionalism and respect for JT's wishes. Although JT has aphasia, both nurses take into consideration that all cases of this condition vary, and they assess her in the beginning to obtain the best information regarding her condition. This is important because when biases are lifted, nurses can go into an assessment with an open mind and create an individualized plan of care. And we're going to do a quick physical assessment. I was looking at your chart and I saw that you've had a stroke recently. Is that true?
Yes.
There's right side impairment, so she's having a little trouble with that.
Okay. Is her right side weaker, you would say?
Definitely.
Okay. And has that affected her walking, her eating?
Yeah, she has trouble walking, and she kind of shuffles when she walks.
Oh, okay. Okay. Well, JT, I am going to have you put your arms out like this. And I'm going to have you push up as hard as you can.
Strong and equal by
Okay. Alright, so it definitely looks like she does have a lot of weakness on her right side. So we're going to try and think of what we can do to keep her here in the assisted living, since that's what you guys would like to do, is what I've read, and we'll go from there.
It is important to assess a patient's self-care and what activities they can do independently. Self-care is an important aspect of life and is especially important for elderly people trying to live independently as possible. There is a link found between self-care and quality of life.
We're going to ask you some questions, okay? Just pertaining to your overall health.
Okay.
Okay, Julian, so I'm just going to give you some information on developmental stages. including aging changes, there are some developmental stages that occur during aging. So some examples of that could be accepting yourself as an aging person, maintaining satisfactory living arrangements, redefining relationships with adult children and siblings, finding ways to maintain quality of life, adjusting to decreasing health and physical strength are some of them. Do you think that any of these effects that I've listed are having any major impact on your life?
No.
Any depression, anxiety that you've noticed from her changes recently?
No, she's happy as a clam.
Okay, awesome. So I'm just going to ask you a few questions now, just to kind of help get a better picture of her mental health.
Okay, so Jolene, do you have any spiritual factors that affect your living situation?
No.
It is important to assess for spiritual factors, meaning patients' beliefs, because it can affect how the patient views medical care and how they adapt to limitations. In JT's case, there was found to be no spiritual factors influencing patients' care.
No. Okay. Would moving have a positive effect on your sexual health?
Yes.
JT's relationship status is unknown, but switching to an assistant living could improve her sex life as stated by JT herself. A myth is elderly people do not engage in sexual intimacy, but they do, and it is an important part of life. Having intimate relationships later in life can actually give more of a meaningful outlook on life during the aging process.
Okay, good. Does your culture or beliefs affect your current living situation?
No. It is important to assess a patient's culture and beliefs as this influences their beliefs about medical care. JT's culture and beliefs are that the younger generation should take care of their elders. This means that her daughter should be her primary caregiver. The move could affect this if she moves farther away from her daughter and relies more on the help of the facility staff members.
And do you view yourself differently because of your limitations?
No.
Good, thank you. Self-concept is a mental self-image of strengths and weaknesses and encompasses all aspects of psychology and spirituality. Self-concept is important to keep in mind when assessing a patient because their illness may not allow them to meet their own expectations, leading to tension or conflict.
Although the patient Jolene Thompson was not subjected to any recent grief, loss, or death in her life and currently does not have any stressors, it is important to assess these psychosocial influential aspects. It is essential to take into consideration how the patient's race, gender, ethnicity, and socioeconomic factors play a role in their health. For example, it is known that poor members of society are more likely to suffer from diseases, to experience loss of functioning, and to be cognitively and physically impaired. Jolene does not have any health factors that play a vital role in her health.
All right, Jolene, we are all going to help bring you up and help get you ambulated to see how you are ambulated right now. Is that okay?
Yes.
Okay, Jolene, we're going to stand up and we're going to just take a little walk, okay?
Okay.
All right. Take a walk.
Oh no, the rug's in the way.
So I think that as far as nursing diagnoses go, I would say that impaired physical mobility is definitely one, especially because of her Parkinson's and as well as her weakness on her right side from
I
her
agree.
stroke.
Yeah.
But her impaired physical mobility is definitely related to neuromuscular impairment, as evidenced by right leg decreased strength, multiple physical limitations, and decreased ability to turn her right foot with pivoting.
I agree. I think there's also a second diagnosis as well that we could use. She is a risk for falls based on the fact that she drags her feet when she walks, her gait is slow, she shuffles, and she walks in small steps. She has to have use of assistive devices, so her wheelchair, that's going to be an issue if she can't get out of her wheelchair to walk across the room. And then also urinary or bowel incontinence is an issue as well.
Definitely. Well, I think we have some good diagnoses here, and I think that we should just get to planning and getting some interventions to let her stay here. All right, Jolene. So Hallie and I talked about some diagnoses that we had for you, and we were wanting to plan some interventions that we could maybe incorporate into your life and get some expected outcomes that can help you stay here in the assisted living, because that is what you guys would like. So we want to incorporate you guys in the planning process. Does that sound good?
Yes.
Okay, great. So our first diagnosis was impaired physical mobility. So we think for that, we could encourage you and teach you to take large steps instead of the shuffling that you've been doing, just because it can change the way that you walk a lot, and we want your body to move the best it can when it comes to ambulating. We also would like you to perform some range of motion daily, whether it be with help from your daughter or help from anyone else that can do that here. We think that would be really great for improving your impaired physical mobility. And then a way that we can kind of see if you're progressing with that is see if you can perform the activity independently, or maybe just be free of any complications of the immobility.
And then I noticed earlier when you were ambulating that you had a little bit of trouble because of the shuffling with the rug that's on the floor. We want to try and keep pathways clear of clutter or things like a rug, because that can become an issue and we really don't want you to fall. There's another thing that we can do, which is to provide you with non-skid or non-slip footwear, which would be a great thing for you. Really easy to get that. And then I don't necessarily know if you have rugs anywhere else in your home, but it might be a good idea to go through and check those areas and make sure to remove those. Does that sound good and doable?
Yeah, that sounds like something we can do.
Oh, good. I think we could definitely help you.
Okay. And then I guess the best way of seeing if that works is just to see if there's any falls after we implement these new things.
Yes, our goal is to keep you here.
According to the trans-theoretical model of change, it assesses an individual's readiness to implement new healthy behaviors. In this model, there are 6 stages: pre-contemplation, contemplation, preparation, action, maintenance, and termination. Pre-contemplation does not apply since the daughter of the patient has already made a consult with the nurses regarding JT's care. Contemplation. Some interventions are necessary for the daughter to carry out preparation and action to ensure JT's needs are met and she is able to stay in assisted living. Maintenance. Once the assessment has been made, the last phase, the termination phase, is complete.
Okay, so I just want to make sure that you understand what we would need to be implementing here. So if you could maybe repeat back to me the interventions we talked about, that would be helpful.
So you want us to work on some range of motion exercises. You want us to wear non-skid socks, get some rugs off of the floor, and as well as bigger steps when walking.
Perfect. So as long as you're comfortable and you feel like you understand all of the things that need to happen, then I think that this will work out just great.
Okay.
Thank you. Okay, so those sound like great things that we can implement for you. We know that your goal is to stay here in the assisted living facility, and we would really like to see that as the outcome for you.
Yes.
Thank you so much.
Good, thank you guys. Caring is important because it can influence the way people think, feel, and behave towards one another. A number of nursing scholars have developed theories on caring, thus
proving its importance. In this scenario, the nurses provided honest, clear, and accurate information to Jolene. They listened to the patient and the daughter's concerns, complaints, and fears. These fall under nurse caring behaviors as perceived by family.